you've got to retake that stupid test. Boom. Okay. Prostate. Of course, prostate is a very common issue. Practically speaking, every man over 85 will have some prostate enlargement. When you have an enlarged prostate, it's called BPH, benign prostatic hypertrophy. Even though it's called benign prostatic hypertrophy, please remember to write it starts with a hyperplasia. Starts with a hyperplasia, then it becomes a hypertrophy. Hyperplasia is more cells, hypertrophy is large. It's just getting bigger. God bless you, girl. Now, if you look at the sheet, it tells you a lot of what's going on with this poor guy. He's going a lot, so that's frequency. He's got to go all the time, like now, or he's going to pee his pants. And he goes more at night, and then you need to add some things in between those words. Underneath the word frequency, add dribbling, add incontinence, at the bottom, put stars by residual urine, big old stars everywhere, residual urine. And then post-renal acute kidney injury that we just talked about. Post-renal acute kidney injury. Now, every now and then, you guys get blessed with my artwork, and this is one of those times. So you need to feel good about yourselves. Let me just show you what happens, because when I talk about a Turp, it makes sense. So the anatomy of the male on the outside is very much like the anatomy of the male on the inside. So we're going to have a little fun here, and we're going to draw the inside of the anatomy, and then we're going to draw the prostate. Okay. So the inside will be purplish pink. In normal folk, the anatomy on the outside kind of mirrors a little bit of the anatomy on the inside. Scrotal sac, penis, urethra, prostate, bladder, filled with water. So far, so good? Okay, now let's make our precious guy have some enlarged prostate problems, okay? So we're going to enlarge his prostate. Can you tell how he would only dribble urine? Because it's stenosed in that area. Like it took, the prostate itself got so big, it closed in on the urethra. It can close in so much, none of this can come out. And then you have urinary retention, which is also on the bottom of your sheet. So if you look at that bottom section, I think it says urinary stream is decreased. This is where it's gotten so big, It's blocking the flow of the urine out of the body. And here's the problem. You didn't make less urine. It's still in the body. And it's getting to be a lot. And so this is what we call post-renal kidney injury. The urine can't come out. Now, a Turp, which we're going to go over in a few minutes, is going to kind of fix this issue. But the first thing we do is not surgery. And we have a handout on Turps, but don't turn. The first thing we do is we try some medications. Now, the medications that you had to know about, we call them azosins. I'll give you a couple. One is Cardura. The other is Hytrin. And if you look at these two drugs, looks like cardiac, looks like hypertension. And that's important because we use these drugs not just for an enlarged prostate, but also for high blood pressure. So when you give azosin drugs, which are often called alpha blockers, same thing. When you give alpha blockers, azosin drugs, they end, by the way, the generics end in zosins. The generic of these, which you guys don't have to worry about it yet, but you will, they end in zosin. That's why we call them azosin drugs. Okay. All right, so if we give those drugs, it's going to make the patient's blood pressure come down. We like that. Think of beta blocker, alpha blocker. This is going to make the blood pressure come down. But the problem is you didn't give it for the blood pressure. You gave it for BPH in this guy. So what do you have to know as a nurse? Watch his blood pressure because it can bottom out. So the treatment of BPH or the management of BPH, and another one that we use is called mini press. Mini press, and there's your pressure, miniature blood pressure. So it does all three, do the same thing, they decrease the blood pressure. Now, some drugs we give have nothing to do with the blood pressure for the BPH guy, and they are pretty popular, actually, as well. And pregnant women can't touch it. Proscar, Avodart, and then a side drug, which the word itself tells you what it's going to do, is Flomax. Maximizes the flow, helps you dart your urine better. Avodart, I don't know, drive a fast car because you're pissing, I don't know, whatever. So, oh, I like that. Prostate, okay. Proscar for prostate, boom, done. Okay, so those drugs